Okay, we're here. Hello and welcome. Thanks for being here. Hi, Lauren.
Hi, Kylie.
We
How's your
have a
week
very
going?
special, so far so good. This is definitely a highlight moment of our week right now because we have a very special feature that we're introducing to our podcast. And I'm very excited about it because we've got a special guest here for our green room. We're going to call this feature the green room, and that's how we're kicking off. So we are very excited and very fortunate to have Dr. Columbus Batiste here today with us. He is an incredible clinician and advocate in the plant-based world. He's got so much to offer, and we thank you so much for being here today, Dr. Batiste.
Man, I'm excited. No, thank you for having me. I appreciate it. This is good.
Thank you.
Yes, thank you for lending us your genius. I am going to read your bio here because it's pretty awesome. And then we're going to ask you a bit of an icebreaker question.
Sure. Well, maybe my mom should be here since she probably wrote my bio if it's that good.
I
Really?
love that.
Yeah. My bio would probably be one sentence if it were me.
Yeah.
Well,
Amazing.
then, okay, well then, Mama Batiste, I hope that I'm going to be reading this properly. So let's give this a go. Dr. Columbus Batiste is a board-certified interventional cardiologist and regional chief of cardiology for Southern California Permanente Medical Group. In 2010, Dr. Batiste sought to break the cycle of prescriptions and procedures as the sole management of chronic disease and began promoting a long-term solution for his patients through nutrition, stress reduction, and exercise. Understanding that the health of an individual is uniquely tied to their community, Dr. Batiste collaborated on the formation of a nonprofit organization called the Healthy Heart Nation. The mission of Healthy Heart Nation is to improve the health of the community by narrowing disparities in education, business, justice, and ultimately health. Dr. Batiste is a passionate advocate for lifestyle, lecturing across the nation and internationally on the power of plant-based nutrition. His first book, entitled Selfish, A Cardiologist's Guide to Healing a Broken Heart, is available now. So as we welcome you, here, yay.
Thank you, Mom. Thank you,
And
Mom. Thank
you're
you.
welcome, yay. Thank you, Mama Batiste. And as for maybe the most important question
Mm.
to ask you
Mhm.
right away out of the gate is, what song gets you on the dance floor?
Wow. Now, it's crazy that you just say that. You said that, asked that question because it was my second cousin's. I was a pleasant surprise, right? So I was like that pleasant surprise back when I was born. My oldest brother is about 16 years older than I am. And so a lot of my cousins are around that same generation. They're significantly older. So my second cousin just got married. And I'll tell you, she's a lot younger. And they were having songs. And I'm like, I don't. So my song is going to be crazy.
Mhm.
I'm a 90s guy, right? And so all that old school stuff of the Running Man and all the other bits, that's what gets me out there. So, all right, Bobby Brown, My Prerogative. If that comes on,
Yes.
I'm on the dance floor. All
Yes.
right. Now, I'm not saying Bobby Brown right now. I'm saying Bobby Brown back in the day. That would be
With the
me just
fade and
doing, yes, yes. That's getting me
Love-
out there, right? It's guaranteed. It's guaranteed.
I love
I got
it.
shivers. I got
We're 90s.
shivers.
Yeah. We're 90s lovers too here. So you're in good company. And, that's a great song. And it's already playing in my mind right now.
Writing it down because this
Yes.
will come back around someday.
Well, it's going to come back around in this conversation because the title of the song, My Prerogative, like, hey, choice, right? It's my choice.
Right. That's right.
We choose our choice. We're going to talk all about lifestyle choice. But, one of the things that is so fun about that question is when it comes to mind, like you got so excited and like in thinking about that question and like answering it. And when we think about ways that we can move our body that bring us joy and, when it comes to our heart health, we want to, feel inspired to move our body. And so if we can find our playlist of our most favorite songs that will get us up and dancing, get us on the dance floor, that is such a great surefire way to start improving your cardiovascular health.
Absolutely. Absolutely. I always say, everyone's like, oh, how should I exercise? What should I do? I'm like, do something that makes you happy, makes you
Yeah.
laugh, that's fun, that's
Yeah,
engaging. That's the
for
best way.
sure. Yeah.
Always.
Oh my gosh. Wow. I love that song. And I think we're going to have to Maybe Lauren and I will start a little playlist of our
Ah,
favorite songs.
People need to look forward to us being on YouTube because there's going to be green glow dance moves. It's going
oh,
to be,
watch
it's
out.
becoming.
Yeah.
I
Watch
know.
out. I'll have to
I
dust
know.
off my old dance champion trophy. Now, anyone out there in high school, you remember, I won that dance contest back in high school. All right. Now, there may have only been one or two dance moves I did, but they were incredible. And I shut it down. I shut it down. If I do say so myself.
That's
Shut it
amazing.
down. Okay. All right. You know what I think? Now I'm feeling like, so back in 6th grade, me and my best friend, we would stand on top of the park bench during recess and we would do salt and pepper.
Yeah.
We didn't know what any of that meant, but
I was going to say,
I know. We did salt and pepper and we
Yeah.
crushed it. And then later on, now you know, if you know salt and pepper when you're in 6th grade, you'll never forget those lyrics.
no.
Never.
I mean, I remember. Yeah. Anyway, we can go down that road of some of those that era. That's when I paid attention to music, and I was all that stuff. And then, of course, you had to get serious. I'm trying to be a doctor and do
That's
this
right.
health thing, and I have to put aside those things. Of course, right?
No,
Yeah.
you don't have to put aside those things. No.
We're
Yeah.
all going to be rocking out
It's
to My
important.
Prerogative tonight, I think.
Right. That's right.
To the 90s. So, all right. Okay. So we'll get to business at some point here, but this is a great start.
Yeah, for sure. And so, well, you just mentioned, you had to get serious. You're becoming a doctor. So can you tell us a little bit about what inspired you to become a cardiologist specifically and how that ties into your path to lifestyle medicine?
Yeah, well, it's interesting. I mean, growing up, my dad was just kind of like, you're going to be a doctor, a lawyer, a business person. Those are the three options. So I always gravitated towards health and remember looking at books and fumbling over them as a kid. And so, but of course, a good SoCal kid, I wanted to be the Lakers team doctor. Magic Johnson, James Worthy, all that stuff. That was my goal. Until my second year of college, I went to the University of Virginia for an externship. I didn't go there for college. And I rotated with a cardiologist, a female cardiologist, and it grabbed me. It took my heart. And in that moment, we always gravitate to things that we like, right? And it's just like everything just made sense. It's just like my mind opened up and it was like, I love this. So by the time I graduated college, I wrote down as far as what I wanted to do. I said, you know what? My goal is to become the chief of cardiology at UCLA. That's what I wrote down. So I fell short of being at UCLA, but I was blessed to kind of be able to do the other aspects fully. But I absolutely loved it. And in that journey, it's just interesting. You taught all this stuff. And if I'm fully transparent, I love the toys. You get all these fancy equipment, monitors. It's like tech. It's heavy tech driven. And I remember telling people the way the future of cardiology is by doing more procedures in tech. And so what's so interesting is I started getting patients after I would put stents in them and do all these things. And they were like, Doc, what should I eat? What should I do? So I started just saying stuff off the cuff, horribly, right? Just too good I said the 4/7 rule, live by the 4/7 rule. They were like, huh? I said, you do well 4 out of 7 days. I said, nobody likes anything 7 out of 7 days. I said, just eat well, do good, be moderate. 7 out of 7 days. I used to say little things like that. And I shudder even as I tell this story, just because it was just ridiculous that it gave me a sense of authority by wearing a white jacket when I had no authority in terms of my knowledge of that information at all. Right. And so life kind of took its hold in terms of family and so forth. And my dad suffered with chronic disease and ended up passing away. And that really kind of just was the fork in the road for me. Prior to that time, I had started looking through books, trying to look and see like what's out there, just Barnes and Nobles, not at the library, Barnes and Nobles, right? But when my dad passed, it just really hit me in that moment. And so in that moment, I just said, you know what? Okay. I read Esselstyn's book at that point, and it was almost like the light bulb went off with the chapter Moderation Kills. And that basically changed everything in that moment. I started researching, not at Barnes and Nobles, but everywhere else, looking through and finding research and going to their reference source and going to their reference source and really kind of digging in. And it became a passion in terms of looking and uncovering and identifying the power of lifestyle and feeling a sense cheated that I was unaware of that at that moment. I mean, this is not a new story. I think it's, I always tell everyone, I said in many realms, It's like a superhero movie, a good guy, a bad guy. The good guy finds his purpose in life and takes off and does it. But the story is encapsulated differently. Wonder Woman, Batman, Superman, there's different angles to it. And so this is my particular angle. And it just led me to trying to live a life of purpose through this way. And I had so many incredible mentors from Esselstyn who called me up. It's like, you know me from, I was like, this can't be. He was like, hey, this is S, Columbus. And someone had told him at that point, I was chief of cardiology, that there was a cardiologist who was really interested in this. And he called me. Now, someone else who's not as well known as Esselstyn outside the realm, but is Hans Steele, who passed away, also called me. They both called me almost sequentially and just told me whatever I needed to press forward. They would give me whatever resources. They were there to support. And they were true to their words. They really were true to their words in terms of their support of me and mentorship and everything else like that. So there's a lot of folks.
What an incredible, how like to have that type of mentorship where they're actually seeking you out, because I'm guessing they would be looking for that next generation of physicians and clinicians that they can connect with to help motivate and move this message forward. I think that's really powerful that the community is so supportive of one another. Maybe that's part of the power of plants, right? We've deeply rooted.
I'm saying it really is. And here's the crazy part, right? So I'm a real picky eater. There's certain things I like. Now, of course, but I'll try most. So but I'm a texture person first. So when I went, the Esselstyns invited me to come to their house and see what he did. And I replicated that. That's a whole nother story locally. And so when Anne made dinner and dessert, she made this lemon tofu parfait. At that point, I never did. I didn't do tofu. And I certainly wasn't going to, I didn't do yogurt. I don't do yogurts. I still to this day don't do yogurts. That's just a texture. But I tried it and it was actually good. And so I remember thinking like, this is good. It's tasty. I don't feel grossed out, and I would have it again. Now, would I order it off of a menu? Maybe not. But I could. I was like, I would definitely eat it if it were there. And so that's one of the things I tell people is that don't be afraid to try something. Not once, not twice, but at least 3, 4 times. I mean, just try it in different formats, and you might all of a sudden begin to uncover that there is a way in which this nutrition-rich food can be beneficial for you.
For sure. I mean, you said something earlier that it was really interesting that you used to instruct your patients the 4/7 rule. Clearly, you were trying to find something to, explain to your patients about how to eat. When you read the Moderation Kills chapter, I mean, how did that shift go? Like that must have felt like such a big shift of how you were going to start teaching your patients. And where did you go with that in your practice?
It didn't immediately resonate to like how I was going to apply it to others. It was more personal. So, and the reason why I say that is that, if you looked at my dad, you would say that he was moderate. He's better than the average. He wasn't overweight. He didn't smoke. He didn't drink. He didn't eat, excessively. He ate moderately. He liked sweets and liked sodas, whatever else, but it wasn't excessive like that. It was a fair amount. And what just resonated with me is that just like when I prescribe medications for patients, I'll start perhaps with a small dose. Some patients I have to start a little bit moderate. Some other patients I have to start at a high dose to kind of bring their numbers down, whatever it may be. And every patient responds differently. And you never know exactly how you're going to respond. You may respond immediately. It may be in time with medications. For my dad, that was a dose for him that that turned on the flames of inflammation for his body. And it was enough to kind of to push him into disease and ultimately his death. And so what it taught me is the fact that we use terms like moderation when it's something that we want, that we shouldn't have. Whoever says, I'm going to have a moderate amount of arugula. I just want a moderate amount of water. No one says that kind of stuff. I have a moderate amount of, no judgment-free zone, right? I'm going to have a moderate amount, this is not me, I'm saying, talking to your audience, of alcohol, or I'm going to have a moderate amount of cake, or I'm going to have a moderate amount of cookies, or I'm going to have a moderate, just a small piece, it's moderate, of candy. We use that in terms of things that we probably know we shouldn't be having, we shouldn't ingest, but we never use it for things that we absolutely know are being helpful to our bodies.
That's a very interesting point. And you're right. It's so funny because in all the time I've coached my clients and the people I've worked with to help them with their lifestyle modifications, I've never said eat a moderate amount of fruit or vegetable. No, those are the things that we recommend eat an abundance of. I mean, truly, we want people to put the good things in as much as possible. So that's such a great, awareness there.
Yeah, it was just an aha moment,
Yeah.
it's because I mean, I was a perpetual, still probably am, not probably, I still am a snackaholic. I'm a junk
Right.
food addict. I'm a recovering sugarholic. So I recognize that small amounts, if I'm like most Americans, I can't have small amounts because I'm going to go to town, whether or not it's in the privacy or if it's in public. And so for me as an individual, and you have to recognize who you are as an individual, that's probably not consistent with what my plan is. I was taught in med school. I remember I had this infectious disease attending. And so she said, Batiste, your plan has to match your impression. If your impression is that there's a broken bone, your plan should be that you're going to cast it. You're going to do surgery. And so they should never be discordant. They should be concordant. So if my plan is I want to live a healthful life, I want to be in shape like this guy I know named Cyrus, right? I mean, if that's my plan, if that's my impression, my plan has to follow suit. That means that my daily life, my daily activities have to match what my impression is. Otherwise, I really don't have, that's not my impression. That's not really what I want at all.
I really appreciate you saying that about the sugar. It's something I like to bring up in that case is that when we want dessert, when we want the sweets, they're so visually alluring that we don't gravitate towards them because we're hungry. It tends to be an emotional reaction. And that really leads into something I know we've kind of got on the list to ask you today, and it's stresses, where stress is in heart health, because the tie-in between food and our emotional reaction to food is so strong for so much of our body, for so much of our systems in the body. We think of that direct link between the stomach and the head and our mind and our emotions and our brain health and all of the things. But our heart dealing with stress and then our reactions, give us some insight into that.
Yeah, no, I don't know how you knew I liked stress. I don't like stress, but I like to talk about stress. And, so what I'll say first and foremost is that we all are under stress. That is the one unifying fact within the United States. There is just pervasive stress, that 6-letter word that's there, whether it's financial, educational, relationships, raising kids, whatever it may be, there's stress that's pervasive. And so the question is, I believe that there is a relationship between stress and our health overall, and that our health is tied to our resiliency divided by our stress. The higher our stress, the poorer our health. And I think it's problematic if we tell a person, get over your stress or decrease your stress. We can never get rid of our stress. What we can do is build our resiliency. We have to focus on the resiliency to have any shot. And that's why studies have shown, you go back to 2004, the Inner Heart trial, it showed that there was a direct relationship, a correlation between stress, both at work and in your personal life, with the occurrence of cardiovascular events with heart attacks, and on par with hypertension, smoking, etc. That we know this, that we understand the power and the impact of emotional eating. When I think about my dad who passed away, my mind immediately goes to, he loved soft serve ice cream. I can still picture that old shack-like place, had mold in the windows, how it smelled, the pineapple topping with the whipped cream and the cherry on top that he loved to get. I immediately go back. Now, even as I tell that story, I have a sense of warmth inside of me, thinking about my father. So you have this emotional connection that we make this immediate tie with our foods. So when we get stressed and we have fear, we have anxiety, all these things spring up, we're looking for something that is going to help alleviate that immediately. And we naturally turn to this idea of sugar, refined products that are there that do actually lower that briefly, transiently. The problem is it dissipates so quick, and through a number of different other mechanisms, we go back for more and more and more. And the problem is we are always chasing that feeling we got before. Now we can say we see that in multiple realms. In relationships, at times, some people, that leads them to cheat and they run around chasing that feeling of the chase. Same thing with food. We're looking for that same burst of flavor we had from that bite of chocolate, that bite of cake, that bite of whatever, and we keep eating it and searching. And so as a result of all of these factors, of this intense stress, studies have shown the impact on the coronary arteries, on the vascular system, that the stress cascade of initiating the sympathetic nervous system, it leads to disruption of the endothelium and leads to damage where now you have a restricted capacity of the vessel to dilate, and it stays constricted. It increases the chance and likelihood of disruption of plaque that leads to heart attacks. We know the impact with broken heart syndrome. That happens more in women than it happens in men. That a result of the immense emotional stress, it leads to the heart no longer contracting. I can go on and on and on about the perilous impact of stress. It's enough to get us stressed out talking about it.
For sure. Well, it's funny. I just read an article on the broken heart syndrome, and it was so fascinating. It was something that Lauren and I were going to dive into. What can people do when you tell somebody, like, we're not going to tell you to get over your stress or manage your stress? Obviously, there are things that people can do and that are within our control to help to become more resilient, as you said, which I just like, chef's kiss. Love, love, love that. For example, how would somebody know that their stress is to a point or their resilience is not high enough that they are experiencing cardiovascular symptoms from their actual stress levels? Like, is there any measurement? Cortisol levels come to mind for me, but is there anything other than like the blood pressure monitoring, regular blood pressure monitoring? Is there anything that people can do to kind of see the impact of this ongoing stressors in their life and there may be that proportion of resilience that they may be off, Have you found anything that?
Well, I mean, I think this easy non-tech, I'm a tech person. I have all the rings on, monitoring me, everything of that sort. But what I'll say is ask the person who's closest to you. They will be able to tell you if you're stressed. They're going to be able to look at you. They're going to see your trouble with sleeping. They're going to be able to observe you. We live in such a chronic state of stress that we're used to it. It's a norm. It's no longer the abnorm. It's a norm. When we say that we're stressed, is now we move from like a mid-level stress that's constantly simmering to an extreme level of stress that leads to burnout. And that's what we're now in this day and age really designating, is what my opinion is. But when we look at tools overall, we can look at things called heart rate variability. And so many monitors have this now embedded, whether or not your wearable watch or a ring, whatever it may be, they may reflect on stress levels that they're pulling from your heart rate variability. Now, what that means is think of it in terms of your heart beating beat to beat. If you see a swing that's wide, you're relaxed, right? You're loose. If you're uptight and it's narrow, right, then that means that you're highly stressed and your sympathetic nervous system is in overdrive. That's acting up. If you're prone towards palpitations and skip beats that are there, that may or may not be reflective of it. Sometimes it can be a hormonal shift for women. Sometimes it can be an issue with hydration. Sometimes there's multiple factors. It could be an issue with sleep deficits that are there. But sleep brings up another identifying factor. So I can tell you, I'll share with you. So how do I know when I'm stressed? So part of my job, I have to wear this lead suit that's there and to protect against radiation. So, and then typing there, I'll have like neck problems. Yes, even Mr. Plant-Based. I'll have like neck that I make sure that I'm getting my heat therapy, my massage therapy, things of that nature on a regular basis. So I'm fine. But here's the thing that's so interesting to me. When I go on vacation, real vacation, not vacation where I'm going to give a talk and it's a nice spot, but vacation where I do nothing whatsoever. Internet is stinky. I can't hardly get access to anything at all. I sleep like a baby and I have zero neck pain. That's my stressor. That's my stressor. I know that I've been able to identify what's going on with me. And I'll take, all right, last little bit here. And I know I'm long-winded with these. See what happens when you get me talking, right?
Good. We're here for it.
I'll never forget when I finished up training, I was preparing to take my board certification. I had my son. I was married. My in-laws, bless their heart, came out to stay with me for almost a year. Bless their hearts, right? Yes, that was the best time of my life. And all of a sudden, I just had this immense pain that my arm went numb. I was like, what is going on? I was like, I cannot have an issue. I used my hands and this was before before lifestyle. I went to see a therapist, physical therapist, trying to get something done. It was this big man who was there, and he was just kind of like, he was like, "Have you been under stress?" I was like, "Wait, stress? Come on. I'm good. I don't get stressed. I'm a doctor. I don't get stressed. Come on." He was like, "Well, I'm seeing some features here. I think you may have to look at that." In that moment, I decided I was going to pause and stop, work on my sleep and exercise, go slow to go far. Like I tell patients now, you go slow to go far. Everything improved. Everything improved. Stress is real. It's real, right? It's real. It's just hard to quantify. And everyone's perception of stress is so different. And that's why the saying that life is 10% what happens to you, 90% how you respond is so true. It really is true.
It's so true. I mean, and it's funny because one of the things that comes up in medical exams a lot of times is these questions of like, do you have pain? Sort of like a yes or no, or do you have stress? Is your life stressful? And it can be very hard to quantify when you're living in it, like you're saying, like when you're experiencing it. And so when you just listed off all those things that were stressful in your life, and you're sitting there with the physical therapist saying, "I'm fine. I'm totally fine. New baby, board exams, in-laws living with me." I mean, these are big life things that were happening in your life, big life changes, transitions. We know that those are stress, those things will increase stress. And even the most resilient person will still have some stress, symptoms of that stress. And so, I find that really interesting that when we, as care providers, those of us who are working with people, maybe not what you ask, but maybe the question needs to be, tell me about your life. Tell me what's going on. Because when you say all those things and that gets reflected back, and unfortunately, as we all know, our healthcare system isn't really well set up for those kinds of conversations, the real detailed like to really say, well, that sounds like a lot. Sounds like you're dealing with quite a lot right now.
But I'll tell you though, Kylie, what I learned to ask patients was one simple thing. Tell me the last time that you laughed or that you did something just for you, for your family, not for your spouse or significant other or your child, just for you. And it was always interesting, the blank stares I would get, and everyone would pause and they would sit there and they would struggle, and it would tell me volumes as it relates to like their level of stress that they have in their life in that moment, that they aren't taking moments of time to even stop and take a deep breath.
Do we know, based on cardiac research, does it make any very clear statements that stress is the number one factor as to why you see women in your clinic? Do we know if stress is the number one thing to pay attention to for women related to their heart health?
Well, I will tell you that I've searched extensively to find what the reference is, the source, but what's commonly referenced is 80% of clinic visits are due to stress. Now, it's not clinic visits in women. It's all clinic visits, right? So we understand the perilous impact. Now, I think women are in my estimation, are under even more stress than men, right? And because I believe in terms of the responsibilities of, I'll say it, relationship. If a relationship, it falters, it's folks look at the woman. I think if there's key issues with the kids, they look at, if my kids act up, they're not looking at me per se, they're looking at my wife more so. And so that's a lot of pressure. And then you have the patriarchal societal things that get passed on and you don't even think about it, but the expectations of like, whether it's cooking, if it's cleaning, if it's all these things, if it's working, if it's contributing, all these. So you have all these things that mount up, not to mention how you have to express yourself when you're out in public, right? So if you're in a workplace and you come across very dominant, how are you characterized coming across dominant? That you have to actually be thoughtful on how you speak. So you look at this building level of stress that's pervasive for women and multiple others. I'm just speaking right now, targeted. Yeah, it makes sense. And the fact on top of it that your symptoms may have been overlooked, as we know that they have been for years, because women are from, men are from Mars, women are from Venus. And so when you're having back discomfort or fatigue or shortness of breath or nausea, and that actually is related to heart disease, and it's not the classic prototypical Levine sign of chest going to your jaw and breaking out in a sweat and looking like Fred Sanford from Sanford and Son. No, you're looking calm, but you're like, I'm not feeling well because you've had to shoulder those burdens and be a superwoman for everyone around you. Yeah, stress is high.
I want to ask our listeners to do something right now, if they dare, and they pretty much stopped in their tracks after hearing what you said. It's, how many times have you said, I'm fine today? After all of the things that you just described, it's job, it's kids, it's errands, it's all the things that you take on because you want to be able to handle it and be the superwoman warrior princess that you are in your space. But how many times did you say, no, I'm fine? And I know it comes up for us all the time. We might ask someone, when's the last time you ate today? It's 5 p.m.
Yeah.
Coffee is not a food group. So, right. And so, yeah, it really resonates, I think. And so I do want people to take a second, just really, I mean, if you say I'm fine more than our other favorite F word, of course, which is fiber, then let's just check in for a second.
I mean, that's a great check-in. And I mean, that was so well said in terms of the sort of culmination of stress. You know, it's one of those things that, and I'm somebody, I've talked about this already on the podcast, like I've been experiencing anxiety for practically my whole life, but you know, I've learned about it. I've learned to understand it and build the tools like you're talking about, but that takes time. It takes a lot of awareness and somebody kind of pointing out to me that, like my therapist, who was like, this is a lot, like you're doing a lot of things and so you know, maybe the conversation really starts outside of the doctor's office and with like your best friend or your partner. You know, what are the things that you're seeing in me to kind of get that gauge, like you said, like the person that is observing you, to maybe give you that feedback. If you're in your mind right now thinking, is this me? It might be worth asking that question of a friend or loved one that could help you assess that. And then also, you know, you started to talk about some of the symptoms that women experience in terms of, you know, whether it's building heart disease, hypertension symptoms or heart attack symptoms. Like, can you go in a little bit more about that? Because I think that is a very big highlight here. The symptomology for women when it comes to cardiovascular symptoms, you know, are considerably different. Maybe you could weigh in a little bit on why that is or what they are a little bit more in depth. That would be fantastic.
Absolutely. So, I mean, I think it starts off, but even before there's symptoms, right? So you get to primary prevention or primordial prevention before you even get to secondary, which all that basically means is before you actually have disease, that you're actually trying to deal with it. So think of it like before you get married or before you get in a relationship, you're kind of building your character and you're trying to make sure you know who you are. You know who you are before you get into a relationship with someone else. So with primordial or primary prevention, you're trying to make sure you get the health of an individual situated so they can withstand having an event in the first place. But that really requires awareness. Studies have demonstrated that women are less likely to have the basic screenings that are more likely to occur in men. So knowing what your blood pressure is, knowing what your A1C is, knowing what your ApoB is, apoprotein B, apolipoprotein B, your lipoprotein A, your C-reactive protein, your LDL, low-density lipoprotein C, which apoprotein B really kind of sums up the total risk that's there. Knowing what those numbers are that can portend your risk up front. Understanding the fact that women are born superheroes, right? That's clear. But you lose some of that superhero shine when you start to go through menopause. So when the hormones, the estrogen, the protective nature of estrogen comes off, and now we have accumulation of fat inside the central area around the organs and visceral fat that then leads to metabolic activity. We see an increase in surge in blood pressure elevation, diabetes, cardiovascular events begin to occur too as well, are consistent. And so that's the time we have to be even much more intentional in our use of other therapies. So now I'm building all this stuff along with the fact that the perception of the way in which symptoms have been taught since the dawn of time for heart disease are, you have chest pressure that lasts for 2 to 20 minutes. It occurs with exertion. It alleviates with rest, right? Those are the things. It may travel to your neck, to your shoulder, based upon the dermatomes that are there. If it lasts less than that or it occurs a lot longer, you're thinking it may not be the heart. Well, so now I have someone, I'm taught this, it's ingrained in my mind, who walks in, he's like, Doc, I'm worried about what's going on with me. I'm short of breath and I'm fatigued. Okay. Well, those are what we characterize as constitutional symptoms. So what do we mean by when we say things like words like constitutional symptoms? I always give the analogy of my daughter, right? So my daughter now is 20, my baby. And so I remember when she was a little girl, I was visiting my dad, my mom at their house. And so she had eaten, she's always precocious, could always speak really well. And so she was about 2.5, 3. She said, "Today my tummy hurts." It's like, she's fine. She ate. She's been doing okay. I'm like, she's okay. She's probably nervous and wants attention. It's like, "Brooke, you're fine, blah, blah, blah. Let's kind of go." "Today my tummy hurts." I'm like, she's fine. And she kept saying my tummy hurts before she went, "Bleh." Now, saying my tummy hurts to a parent could mean so many things. All the things I mentioned: nervous, maybe you have to poop, maybe you're hungry, maybe you're scared, maybe you're fear. I mean, any of those things. That's what we call constitutional, where it's not very specific. It doesn't point us that this is the cause. And so you begin to kind of search, well, what could it be? It doesn't sound like this, that, or the other. And so that's what, when women present with a little back discomfort, a little fatigue, a little nausea, a little bit of lightheadedness, those are what we characterize as constitutional symptoms, that unless you have a level of awareness of what could be going on, they could actually be the heart, especially if I'm aware of the risk factors up front, if I'm aware of the family history, her past medical, past surgical history up front. Now it may build a level of a story, right? That's there. And that's what's important. And why that's so important is, if I say I'm going to vacation in the summer in California, probably don't have to bring an umbrella. If I say I'm going to Florida, you may have to bring an umbrella. Knowing the situation and where you're at is so important in terms of the context. And so contextually understanding that I'm speaking to a female and that this may be there, those are some of the risk factors that happen, because you may not have symptoms with high blood pressure. You won't have symptoms with diabetes necessarily. You may not have symptoms with heart disease, because 20% of heart attacks are silent, which means they never manifest as any symptom. So those are some of the reasons why it's important to know upfront. And here's another little, I won't say fun fact, or important concept to bring up about heart disease. If I were to ask you, so Lauren, I'm gonna put you on the spot, which one is more likely to lead to a heart attack? A blockage of 30%, 70%, or 90%?
Can I say all of the above?
No, that wasn't a choice.
What's in the blockage exactly?
They're all thin cap fibroatheroma that's in there.
Well, that's easy to understand, isn't it?
Oh, I love it. I love it.
I was going to say 30%. I don't know. Why not?
You're actually right. So most people, right? Now, contextually with it, they'll say 90%. That was a heart attack waiting to happen. It's not. It's the areas that are 30% that would never show up on an EKG, would never manifest as symptoms, that would never cause any issues. That's why it's important to treat yourself as if you already have heart disease.
Yeah, I feel like my jaw's on the floor right now, because you're right. I would have assumed 70 to 90% would have been the answer. So why is that 30% the correct answer?
Well, because oftentimes, think of it like the Grand Canyon, right? So if I dig up my backyard and the wife says, "Okay, build a pool," I'm shoveling up all that dirt. I can kick it if I get angry, and it's going to crumble down. I'll let that dirt mound up over centuries and become a hard stone. There's a thick cap that's over it. I kick it, I'm breaking my foot, right? So that's the same thing with chronic blockage in the arteries. Typically, they develop slowly over time and they build a thick cap over it. They're less likely to erupt easily. The thinner, newer mounds, think of it like an eggshell that could crack easily. When it exposes its content like a pimple that burst, body goes into overdrive in order to stop it by clot forming. And that's how a heart attack can occur in that moment. Older studies in the 80s and 90s kind of demonstrate that the majority of heart attacks happen from areas of blockage 50% and less likely from areas that we're thinking in terms of 70, 80, 90%. I haven't seen any newer updated studies necessarily with that, but we know that to be the case. And we'll see it sometimes in clinical practice as well.
You know, this is bringing me back. I'm coming back to one of the first things you said was about moderation kills. I mean, 30% blockage is a moderate, right? It's not an excessive amount. It's not an abundance of an amount of blockage. 30% is moderate. And look at that, moderation kills. I mean, this is so significant to me because I think about the mindset of a lot of people who, like, I've had family members or friends who will share lab results with me, right? Like, what does this mean? Or what's, and, they may have borderline high cholesterol. They're like, oh, it's not that bad. It's just borderline. I've seen, a clinician may even say, we've seen worse. But actually what you're pointing out is that in terms of risk for heart attack actually occurring, which is the most significant, I mean, I'm assuming, does that also increase the risk for stroke? Which is also
when you look at the entire cardiovascular system, there is a level of risk that's all throughout.
Sure. So if you're looking at, this is why we really want to promote the optimization of every choice you're making at this point so that you have the resilience in your body. If you're a woman in your 30s, your 40s, your 50s, maybe you're approaching menopause, you're going to lose that cardiovascular protection of the estrogens. Having more resilience now, this is the time. Build the resilience. Get these tests, understand your baseline. Borderline is not good enough, right? We want those the cholesterol levels low. We want your blood pressure in a healthy range. Like, this is really important to understand. And once again, I bring this point up a lot, Columbus. It's that we are not given instruction manuals for our body. So we are aiming to help people, women, men, understand. And there is a time frame, right, that you can actually really gain a lot of resilience in your health and which becomes preventative in terms of these major risks for things like heart attack. I mean, that's
what it's all about. I mean, I tell patients a lot of times, and I'll ask the same question for almost everyone, is just the majority of Americans are having to invest in their retirement, whether it's forced through Social Security, whether or not on their own through a 401k or whatever the particular venue is, they put money aside. I haven't met one person who says that they wouldn't want to use that money right now, that they couldn't use that money right now. That it does require some level of sacrifice. And I asked them, my follow-up questions, well, why do you do this? Why are you putting money aside? But after you get past, I have to. Well, because I want to live life the way that I want to live. Because I want to live my life in the future after I retire that I'm able to sustain. And so I'm willing to, and basically it gets down to they're willing to sacrifice right now for that purpose. And they no longer see it as a sacrifice. And I tell them, I said, the same thing relates to your health. You're investing in your future health state. Because what good is it for you to put money aside that you'll never see, that your family's going to see, but you won't see whatsoever? I said, so doesn't it make sense that you can live the life you want to live in the future? And I'll joke with them. I'll tell them, I said, imagine I'm Tom Cruise. I'm Tom Cruise. I said, I'm from the Minority Report, right? That's an old movie. You guys probably haven't seen it, right?
I definitely have. Oh,
you
yeah.
Seen that? You know that one?
Yeah.
Lauren hasn't seen that movie. All right. Lauren, that's your assignment. I'm writing you a prescription to watch Minority Report, Lauren.
Tom Cruise isn't one of my guys. I mean,
listen. I'm not talking about visually of like, oh, this is my guy.
I'm looking for chainmail. I love an accent. I love history, and that'll do it. But okay, Minority Report. It's on the list.
Well, now I have to go off the tangent for a second. Okay, who's your guy, Lauren? Who's your guy? Or what's your favorite movie? Give me your top movie.
Top movie?
Yeah, one movie.
Well, the movie that I know the best, that I can recite line by line.
Okay, yeah, sure.
Since it is Princess Bride. That did it for me in the very beginning. My dad and I can do Princess Bride back and forth forever. Forever. Does anybody want a peanut? No more rhymes now. I mean it. We've got them all. But yes, anything Vikings, anything, usually with horses and swords. It's kind of my thing.
Are you a Game of Thrones girl?
I've seen Game of Thrones, of course. There's plenty of swords and mystery and fantasy, but
okay. I have a movie for you to watch. Sorry, I know we're supposed to be talking about health, and I actually forgot where I was going.
Two movies now. We had one. We had Minority Report. Is there another one?
Thank you. I'll get back to Minority Report.
Okay.
The Count of Monte Cristo.
Seen it, love it. Love it. One of my favorites. Absolutely.
Boom.
Some of the best lines. Talk about resilience. Locked up, you learn from a master.
Yeah.
And you get yourself out of there.
Love it.
I used to use quotes from that, and shame on me that I've never read the book.
No worries. Secret,
but, I haven't. Right. let's go back to something before I forget. Something I was thinking of in a word, hope injection. I want to throw a little hope injection into this because the hope injection is if you are someone who has warning signs, you have had a heart attack, you have had stents placed, we can lighten the room here and kind of bring us back into something to remind ourselves to let go of the stress, but it doesn't really divert from the seriousness of our conversation, which is how are you taking care of your heart? But now a little bit of hope sprinkled in. Are you saying that heart disease is reversible?
So whether I say it's reversible, and here's what I love saying, right? So, because I love the English language, we use these words. So whether I say remission, whether I say reversible, what is the point of both of those? The clinical point as a provider is for a person to go without symptoms, their symptoms to go away. The second thing is to decrease the likelihood they're going to have a recurrent event. It's not that you're going to live forever, but that I can decrease the likelihood you're going to have a recurrent event. And I can say that and with a straight face based on the literature, that by adopting a lifestyle approach centered around a whole food plant-based diet, you can accomplish both of those without any question in my mind whatsoever. That we can decrease your symptoms. We can decrease the likelihood of you developing it. So back to the Minority Report, that's in that movie, Tom Cruise goes back in time as a police officer to stop a crime before it happens. That's the basic premise of it. So I tell patients all the time, I've been sent from your future to give you a warning that if you don't make a change right now, right? If you don't make a change right now, that there's bad things waiting for you. And this is your one opportunity. And so they'll chuckle and they'll laugh and we'll go through, and I have fun with my patients, even though they're a captive audience. They're post-procedure lying on the gurney. They have to listen to me and pretend to laugh, whether they like it or not. So I'm like a huge stand-up comedian, everything. Okay, doctor, sure, whatever you say. I have a look.
That though, you take that advantage of that moment though, at a time where maybe they were scared, they feel like they're going to be okay. And now you're providing in that moment, you're taking that opportunity to say, hey, listen, we're going to be okay now, but like, I'm from your future. I think that is brilliant. That is such a great approach, and using some humor with that, right? And relatable movie that people can relate to. I mean, I think, unfortunately, what some of the things that I've experienced in the healthcare setting is that there's this opposition of wanting to teach patients that they can do something differently. And what you're showing with your own patients and also to your colleagues, right, is that you're saying, no, you can do something different. And I believe in you, right? And that is so inspiring. I mean, I've not come across very many physicians who will be, playing the stand-up comedian post-procedure, and also making those really important points to their patient.
It is. And you said something that I want to make sure I tease out for the audience, because I think we overlook this so many times. And you said that I believe in them. And I'll tell you that the power of belief is huge. And I always go back to this, is the fact that what do we test all of our medications or procedures against? Placebo. Placebo is an inert substance, has no biological activity. And we're comparing it to something that has been formulated, spent time, millions of dollars to prove that it's beneficial. What really are we testing this high-priced medication against? The power of the mind. With I give you a placebo that has no chemical benefit to the body, I'm really saying, do you believe in this pill is going to help you? That's really what I'm testing. And we see that people will show a benefit from the placebo. That's why the gold standard is the new medication has to beat out your mind. But here's the catch. You also have to believe in the new medication. So how powerful I'm not anti-medication. Let me get that. Let's put that out. All right. So prescribe it. But I'm telling you the power of belief. We can't minimize it because it's something that we can't grasp hold of. It's a similar concept to stress. How can I quantify your stress, Kylie, versus yours, Lauren? That's hard for me to do as a clinician. And it's hard for me to capture the significance of belief. All I can tell you is like the wind, it's forceful. I can tell you like the wind, it's impactful, and it can make changes occur if you lean into it. And so it's something I tell patients about. That's one of the E's in selfish. It's not just exercise physically, but exercising your belief that you can overcome. And I think it's powerful. It's important.
I love that. And I want to ask you a question that will give you the opportunity to tell me that I'm wrong. So I'd like to know this. So I teach indoor cycling classes, which I think is the most powerful thing you can do for the heart. And something I say, what's that?
I say, I'm a
Well, we can do better, but it's fine. Hey, when you're in St. Paul, Minnesota,
we're going to race. Me and you, we're going to race so you can beat me.
On an indoor cycling bike?
No, I don't want to race you because right now you already said, I see that
Scary.
look in your eye.
That's scary.
That's a competitive look right there.
See, Kylie, we talked about that. I told you I cannot be given the opportunity to be competitive. It's not okay.
Not allowed. Not allowed to compete. I'm going to X that out right now.
But I have a feeling Kylie and Cyrus are going to be there too. And then it's going to be a blood. We're going to need thank you for being the cardiologist in the room. If we end up getting competitive, that means we have to make sure you're okay. Because it's going to go too far. So something I try to say to motivate my group or just to kind of keep them in mind, I talk a lot about heart rate and the feeling of these intervals, and we never want to keep you too high for too long. We want to keep the heart working. And I'll say to them, the heart loves to work. It's like your most important muscle. It wants to do the work. So let's give it the challenge. Am I saying something correctly when I put it in that perspective?
I actually do think you are saying it correctly, right? So the heart is made to work. It's made to work irrespective of what we do. That's the beauty of it, is that it does it independent of conscious thought. And here's the thing is that when we go through our efforts of exercise, it's almost like we're training our body to respond to stress. We're going through boot camp, and it's preparing us for the big stage when these inevitable stress is going to hit us. That now our body is more in tune and able to respond to it. And so I think all of the avenues, exercise, are sleep, right? I always tell patients, right? It's how you feed your body, move your body, rest your body that are important. And all these avenues are so imperative to withstanding the stressors of life and these health challenges. So I do think so. And the whole system of what begins to happen as we exercise and as we move our bodies and so forth. So it's important.
Good. I love that. I think of it as the runner's high, the feeling that so many people get in small doses too, just with exercise. It could be, on vacation, as you had mentioned, if someone goes on a vacation where they're a bit active, I was thinking of like Hawaii, or someone goes to Utah, they're going somewhere where, you're going to be hiking something, or you're going to be, you're going to be working, and you do it because of the enjoyment of what you're going to see. And it doesn't have to be this super intense level of cardio, but it feels so good to get there, to complete it, to be in that moment, and bringing people back into what can you do for your heart, to love yourself, to take care of yourself, finding something that you love to do, but keeping in mind that there isn't really a wrong answer there when it comes to exercise. You get your heart rate up in any amount, you're doing something right.
Absolutely. And here's the crazy part, how it's all related. So when you're eating, you're absorbing all the dark green leafy vegetables that are rich in nitric oxide and so forth, and they're stored underneath the skin. So as you begin to exercise and you have small bouts of sunlight, studies have shown that you release that nitric oxide that then allows the blood vessels to dilate. So now and then we know that when you're outside and you're getting the small dose of melatonin from the sunlight, that's triggering the melanocyte stimulating hormone that's there, your sleep becomes improved. And so you have this interconnectedness between what we move, how we feed our bodies, and how we rest our bodies when we choose the right way. But when we don't, when we take the fake resources and we get the cheap way out, right? And we have all the crappy food, right? Overprocessed, highly refined foods that are there, and we feel tired, too tired to move. That now we're just sitting down, we're flipping the TV, and we get poor sleep. And then the vicious cycle begins as we increase our caffeine intake and we're not moving. And we wonder why we feel poorly and we're ill prepared for the stressors of life that easily knock us off our feet. So it's insane when you start to kind of think about the rat race of life and how large segments of our population get just thrusted into this vicious cycle. Have to stop.
Yeah, it's so true. I want to hear you talk a little bit more about your book and what you put into your book around this, because, I could sit here and talk with you and listen to you all day, as I'm sure our listeners are enjoying this conversation very much. But if they want to hear more from you and about your work, what did you put into your book around this idea of it's called Selfish, right? This is the name of the book. And I know there's a longer title. There's another part of the title too.
That's most.
Where did the name come from? Like, what did you put inside this book? And is this culmination of your life's work? This is
Yeah.
your first.
Yeah. I want to say it's my first book. And
Yeah.
what I would tell you is that, all right, so here's the reality is that I always reference, once again, another movie, Beautiful Mind, Russell Crowe, great actor, right? And so what's crazy about The Beautiful Mind is like you would see all these numbers kind of come together and it would take shape and take form. So I was listening to what I always kind of joke around and say is the second best basketball player to ever lace him up in Michael Jordan. And he made a statement that he said that in order to be successful, basically you had to be selfish or else you'll never succeed. I was like, what? Like, I started thinking from an athlete perspective, for whatever your intention, there's a lot of truth to that. And then as I started coming through, I started reflecting on the conversations I'd have with my patients, literally. And the pillars of health came into play as selfish: spirituality, exercise, love, food, intimacy of relationships, sleep, humor. And as I looked at these in the research that I would do periodically, I recognized how each of them actually literally plays a role not only in decreasing stress, but actually healing the heart, healing the endothelium, healing the lining of the vessels, and how they play a role that's integrated. And so when you look at spirituality, and some folks are put off when they think, okay, well, that's religious, I'm not religious and so forth. But you think of it, it's not just from a religious perspective, although yes, it does include meditation and prayer. And the studies showing the strengthening of the prefrontal cortex, diminishment of stress hormones, relaxing the blood vessels, lowering blood pressure has been demonstrated. Also breath, that the Latin root for spiritual or spirit is spiritus, which is breath. And what don't we do when we're holding our breath? Not literally, but our breathing becomes so shallow, so restricted. Literally, if I'm in a complex case, I now pay attention to my body, and it's like, breathe. Not this shallow business. Take a deep breath in and out, because when we breathe out, we're activating the parasympathetic tone that helps dilate the vessels as our tend and befriend, so to speak, state of health. That's spirituality. The exercise, I talked about that already in terms of, and Lauren's up here trying to challenge me and get beat by someone about 50 years older than her, but that's okay. It's a different subject for a different day. I'm not even going to go there right now. Right? I don't want to embarrass you like that, Lauren.
That's right.
Because it's supposed to be
Challenge
love and friendly. So let's get to the love part, right? Let's get to the love part, because I want to make sure this stays nice and happy. We're going to get to the happy part at the end too as well.
Well, I've already forgotten about that challenge, and now we're right back into the checklist of things that I have to do on my bucket list, which is throw down with a cardiologist in the spin studio.
Oh my gosh. I will set this up.
Well, I already got one of your songs on the playlist, so we'll see if it motivates you or if it scales you back, or if it distracts you.
Exactly.
But
I know.
And that is something so important for everyone to know, is music is a motivator.
Yes.
Music is a motivator. It's also a mellow outer.
Yes.
Are less scientific terms, but that's it. It doesn't always have to be scientific. It's what feels good, what feels right. I have a 45 different playlists, quite honestly, in my Spotify, and they all have something to do with my mood, I realized. I go to drastic measures to reduce stress. I have learned that in my life with type 1 diabetes, is to really drastically figure out how to chill after my entire 20s. And everyone could probably think of their entire 20s as being super stressed.
Yeah.
Yeah, it's such a nice, it will chill you out. So I think if anybody does feel stressed, it's almost uncontrollable, or their heart rate is up, if you do wear a device and you're moving around during the day and you were just up there. I mean, that is probably, I would have to imagine that's one of the most controllable factors that you might have in taking care of your heart in the first place, is trying to work on the heart rate.
Absolutely. I mean, the heart is very musical. It's very rhythmic. So it actually makes sense. And to be honest, when I give certain talks or lectures, I will substitute one of my S's out. I actually just did that recently for a grief lecture that I did at Loma Linda, and substituted out for song or for and as a reflection of music at that time. So when you get to it, we'll change out in honor of you, Lauren. That second S is no longer going to be sleep. It's going to be songs for today, right? So
Nice.
Nice.
You
In
get
honor,
the
yeah.
E and the L and the F of food,
Or
real food. Yeah.
yes,
We
or
want to encourage, we want to uplift the education of the next generation. Selfish, see that? And that's the thing, selfish can be personal. Selfish, personal. See that? I love it. I love it. But the one central piece that is personal but stays is F for food. That's a central pillar. Real food, whole food, plant-rich foods. Intimacy of relationships, animals, pets, the oxytocin release, the reduction in the stress hormone cascade. We mentioned the S of the science of cycling or sleep, if you don't want to go that long with science of cycling. Last is humor, right? Just the power of laughter, the power of smiling and reducing and lowering blood pressure. It's just so powerful when you think of it. And as I dug into that research, one study that I loved. So there is a program within cardiology called cardiac rehabilitation. And that's a program after individual has suffered with a heart attack, and we put you through nutrition and optimize the medications, exercise, stress reduction, et cetera, et cetera. Phenomenal outcomes. That's really the basis of Dean Ornish's work. It's what we did centered around cardiac rehab. They did one study. One group, go through cardiac rehab. The other group, go through cardiac rehab. I want you to add 30 minutes of something that makes you laugh. It could be the dirtiest comedy. It could be a sitcom. It could be whatever you want, just as long as you laugh. No judgment. To no one's surprise, the group that engaged in laughter had less chest pain called angina, less hospitalizations, less recurrent bouts of heart failure from laughter, the power of laughter, which, as we know, is going to decrease our stress, relaxes our vessels, lowers our blood pressure. There's so much power by laughing. And so now what do? When I'm in the hospital, critical cases, I'm watching a sitcom. All the ones I didn't get a chance to watch in med school and residency and training, I'm watching them like they're brand new on TV. I'm watching it thanks to all the streaming platforms out there. And I'm laughing, literally. I'll even play them when I'm driving home in the vicious traffic just to make myself laugh. And I encourage everyone out there, find something that you can laugh every single day, whatever it is, and no judgment whatsoever.
I feel like we hit on every single one of those just in our time here
together. It's so true. I know. And I love that. What a great study. I mean, 30 minutes a day and the significance of that is just incredible. And to your point, not that it necessarily is a surprise, but the fact that it's so measurable in the form of research just gives it that like full circle. It's just nice to see it in writing too.
Absolutely.
Okay, so I have one other question to follow up on. Who's the number one basketball player of all time?
Who would you say that is?
I heard you said the second.
I did.
I guess I have to really think here. Okay, you said Michael Jordan was second. That's who you were saying.
Yeah. So okay. So
Are you gonna go with LeBron?
Yeah, I'm gonna give you a little secret to like my little jabs that I
It has
like
to be a Laker. It has to be a Laker.
I know Kobe.
Look at that.
I know.
Was it Kobe? No. Oh, sorry.
No, but well, here's the thing. So truth be told is that Michael Jordan is like the greatest basketball skilled player encapsulated in a human being, I believe. Right. So, but I do think that we're subject to the bias of the moment when we're kids. And
for sure.
And so nothing ever surpasses it who that came before us or
right.
after. And so I understand that. And so it's hard. So taking that as, I don't want to knock any of the ones, the greats that came before him. I mean, I think LeBron is incredible. Just the fact that he is like still persistent.
Yeah.
And at age 40, I'm like, oh my, I mean, it's like a Tom Brady thing. It's like I had to finally give my accolades to Brady. I'm a huge Cowboys fan, by the way. I know you all are too as well, if you're following football as well, right? So
obviously.
I live in Minnesota. Somebody could hurt me if I say that. I know. And I don't even watch football, but I know better.
Yeah, that part is true. That's true. So I mean, so I joke and I always will say it's LeBron, but the reality of it is I before had vicious arguments that it's Magic Johnson, and that's the greatest team basketball player, that he was a leader of men and had the skill and so forth. But man, you can't. I saw Jordan once play basketball, that is. And it just literally, when we say Air Jordan, people take it for granted. He literally looked, I don't care about who's in whatever slam dunk contest. This man looked like he was walking on air. He really did. He didn't look like he was jumping. and just so graceful. And you're just like, I would have loved to have seen Dr. J when he was young play like that, who Jordan modeled his game after. But it's hard. I think you just have to appreciate all of them for greatness. I just like saying that just because it always gets, there's always an opinion about it. And so I just like to
Okay. It was very interesting the way you were like, well, the second greatest basketball player of all time. And I was like, I want to take that bait. Again, adding more humor to the day is only going to help us. And I feel like I could sit here and talk with you for hours, but out of respect for everybody's time and your time, and just thank you so much for being here with us. If you would like to learn more from Dr. Batiste and hear him speak, there's lots of opportunities. I saw on your website you've got events scheduled that you're speaking at or presenting at, and also
wow, okay, that's good to know.
I saw through like April or May, you've got a couple of events going on in your community. It looks like you're very active in your community and you participate in a lot of local events where you're teaching and getting to know the people in your community, which is incredible. But also, Lauren and Dr. Batiste, you two will both be presenters at an upcoming conference this year called the Plant-Based Prevention of Disease. It's an organization also known as PPOD, and it's a really great organization, really stressing the importance of plant-based nutrition for the prevention of all diseases. Dr. Batiste, you'll be there. Lauren is going to be there speaking as well. So, and actually, when I say there, I mean you'll be at home because it is a virtual event, which actually makes it so much more accessible. For those of you listening, mark your calendars for September and October, because that's when this event is occurring. We will post a link in our show notes to PPOD and directly to Dr. Batiste's website so that you can check out his book if you're interested in. I know I'm definitely ready to dive in. So
thank you. And I think I'm going to give a note to the coordinators for Peapod. I'm actually going to do my lecture on my Peloton just to show my cardiovascular fitness, and watch the other folks there slack off and just give it behind the computer. I think I'm going to do that just to show that there is no inflection in my voice as and show my heart rate at the same time. But, just Lauren, don't worry about all that. That's just, I'm sorry, I was talking to Kylie, but I forgot you were there for a second. No worries.
Boy, I see a real opportunity here.
I'm gonna be like an elephant in this moment. I'll be quiet about it, but I won't forget.
The challenge is on. I love this so much. Oh my gosh. I love the idea of like the four of us, like with Cyrus, like getting together in a cycle room and like having a spin-off. No, Lauren's like,
well, what would be fun is coordinating a charity ride, because I've never done that and I would love to. But we're going to have to turn you guys into instructors. And I don't know if I'd agree with your style. We'd have to see.
Well, only if he's playing a Bobby Brown playlist with My Prerogative featured at the beginning. And
it's over then. I'm taking off if that's the case.
Just on loop. Just
on loop. One. Yeah. He's just going to be off into the races. Well, thank you so much for being here. This was such an amazing conversation. Like, there's so much to take away from this. And if you're listening, I hope you've enjoyed this and, take one thing away, even if it's just the humor, take that away and enjoy it and just take good care of your heart. Dr. Batiste, thank you so much for being here. Such an honor and a pleasure to have you on. We hope you'll come back again sometime to the green room.
Love to. Thank you, guys.
You already know what he's thinking about for the next time. You don't even have to say it. I know exactly where I could see through it. I could see in there.
We're going to do a live podcast in a spin class. Now we're talking.
I'm there.
We'll keep up the good work. We'll report to duty and see